Hey guys, Dr. Brandon here at One Health Chiropractic. If you're a chiropractic patient, there's two words that you really want to understand, and that is consistency and crisis. When you go to the gym and you are overweight, that is a crisis. And what you will do is you will start to work out over time and get into optimal shape, optimal fitness. And then when you're at that level, you can stop working out and you'll be fit for as long as you live, right? Absolutely not. When you get to that level, you have to be consistent and continue to improve little tiny bits and even maintain where you've gotten, which was from way down here. Chiropractic is no different. Dentistry is no different. Maintaining a car is no different. It's all about consistency. Prevention is way more valuable than waiting for a major crisis to go to the dentist, to start working out, to go to the chiropractor, to go to the medical doctor, or to go to the mechanic. Okay, there's so much value in being consistent versus waiting for a major catastrophe, and especially with your health, the price you pay to win is much less than the price you pay to lose when it comes to your health. Now, in the world of chiropractic, we recommend that patients at least are getting worked on every 3 to 4 weeks. Now, why would that be? Where does that come from? There are new studies out where they actually looked at these misalignments in the spine, these subluxations, and they asked themselves, how long does it take a misalignment in the spine? How long does that take before that starts wreaking havoc in the body? Well, when this happens, almost immediately it starts causing irritation and inflammation to the joint tissues, to the nerve tissues. But also they discovered that about the 3-week mark, the body actually started laying down scar tissue within the joints. A lot of you out there, when you move your neck or you move your low back, you can hear little clicking things, popping type sounds. People will come in and say, it sounds like grinding or sand in there. That is called crepitus. That is a great evidence that there's been some of that scar tissue that's been laid down in your spine. The best way that I know how to take care of this is to keep the spine moving, keep the spine properly aligned, keep those joints well lubricated so they're gliding instead of being restricted in their motion. Every time we adjust the spine and be consistent with our spinal care, we are improving range of motion, which will improve circulation. We're reducing that muscle tension in the body. Where do the muscles attach? Well, they attach to all these pointy things along the spine. If you have a spine that's not cooperating, your muscles can almost never be happy. When we adjust, we're preventing any arthritis or at least slowing that process down. My spine's gonna look a lot worse when I'm 80 than right now when I'm 30, but it will look a lot less worse if I care for it now with consistency. I will tell patients often, I am not a 6-foot tall aspirin. Don't just use a chiropractor for a Hail Mary. Don't use chiropractic as some sort of pain management, crisis, catastrophe type solution to something that's probably been brewing for many years, if not decades. And you don't have to always feel it developing along the way. The development process of degeneration, of disease, it is consistent. And so we all must be consistent with our efforts to combat that process. In your spine, you want to take as good a care of this as you can because these joints and these nerves are your lifeline. They are your lifeline. So do as good as you can, taking care of the spine, all 24 vertebrae, the hips. Jessica's starting to laugh because she can start to feel her vertebra going out of place from holding the camera. So I'm going to cut this now. Thanks for tuning in, and we'll see you next time.